Thank you for joining us today for today's daily COVID-19 update. I have a number of different topics to cover today in addition to our usual case report. I am pleased to have a mask given by Flanders Smith College, and so I was proud to wear that today. And I'm joined today by Secretary Jose Romero, Department of Health. I'm joined by Secretary Preston of the Department of Commerce, and then also by Director of Enforcement at Alcoholic Beverage and Control, and actually broader enforcement than that, but our Director of Enforcement, Mike Moore. And today I want to start off with an announcement that based upon the need in Arkansas, but also the preliminary legislative action, today Arkansas will be submitting its application to FEMA in order to receive the $300 per week enhanced unemployment compensation. Now, the legislature, through peer review, approved that appropriation yesterday. I recognize it still needs to go through the Legislative Council, and we want to be certainly respectful of that. We can withdraw an application if need be, but it will save us days and days if we go ahead and get that application in to allow the FEMA to start processing that. If we do not have the appropriate appropriations for it, we can withdraw that application. But this will put us ahead of the curve, and if all the systems work and say go, then we'll be earlier in line to get those benefits to those Arkansans that are in need. And this is not the $600 that they did have. It's not the $400 that it could be. This is $300, but that's a level that is very important to those in need, as I mentioned. And I do want to thank the legislature for their prompt review yesterday. I know they have more work to as they consider that. In addition, I want to caution everybody that might be a recipient of this that this has to be approved by FEMA. And then secondly, we have to adjust our system to make sure this new amount can flow out. So it takes an adjustment of our system. And it's going to be weeks away, even if everything looks good and everything is approved. And I also caution that the federal guidance could change. They're still in discussions, they're still in debate, Congress still could act. And so that's a little bit uncertain from a federal perspective, but I want to put Arkansas in the best position possible to go ahead and to submit the application to get in line, subject to legislative approval and the federal action that will be needed as well. And then secondly, I want to make a comment on UAMS modeling that was released yesterday. That was before I had an opportunity to comment on it when I was in Blytheville. And as a policy maker, I want all the data that I can get. I'm grateful for ACI that submits, that analyzes data and gives it to us for UAMS and their modeling. And there's always bits and pieces that's helpful to me as a policymaker and to Secretary Romero in terms of the UAS modeling. And we gather that. But in regard to a couple items, the information is really not helpful from a policy-making standpoint. In regard to infections, COVID infections, there will be no data that we will be able to have in the future that shows whether the modeling is right or wrong. And that's because they don't predict active cases that we measure every day or new cases that are tested by a positive result, but they measure all of the infections that may exist and we don't know about, which means that you can't measure the true predictability or accuracy of the prediction of the model that's presented. And so I find not too much value in terms of those projections. But the hospitalizations is concrete as well as the ICU needs. And so that's certainly helpful data that we have, that we look at, and we compare our performance against those models. And one of the things that was pointed out in the modeling, and I'll refresh you back on June 12th, the June 12th UAMS model had our peak of cases being on September 30th. And then on July 3rd, they modified that peak day to October 29th. And that's good news because that means we're flattening out the cases. And then on July 17th, the peak was modified to be on November 26th of this year. And then the most recent modeling shows that the peak is in mid-December. And I think that is good news to show that we are again flattening our increase in cases. We're spreading it out so that our hospital system can respond to the needs and manage the number of cases. And so that's a success story in terms of our flattening that curve, which has been the objective. So flattening the curve, reducing hospital admissions and ICU use is very helpful data, and we can compare ourselves with that. And we'll have more comparisons down the road. Hopefully we can show that we are being successful with wearing the mask, with social distancing, those measures, so that we can be successful and beat those projections, which is what is helpful for us to do. In terms of the cases, we had an additional 729 cases over the last 24 hours. That brings our cases to 54,216. We have 7 additional hospitalizations. That brings it to 499. With 12 additional deaths, it brings it to 631. We had testing. We were up to 6,025 tests, and so that's good news. Our active cases are holding at 5,919, a slight increase from that. And let's go through the graphs, and I'll have some additional comments. This one you can see, obviously we have the increase with the increased number of testing. We've got the increased number of cases, but that's still on the seven-day rolling average. It shows that it's still flat. Hopefully we can go down from there. And then hospitalizations have peaked up a little bit. We continue to watch it, not at our peak yet. The number of active cases in Arkansas, which we've been down at a little level day today, a slight increase, but that's a helpful area to be in right there. And then the 7-day rolling average of positive cases or positivity. And again, we always look at the 10% CDC guideline, and it's down below that, but with those being backfilled, we're real close to that margin, and we need to get that down some more. And this is, I want to talk about our test results. I'll leave it here just for a second, because there's a lot of talk about whether we're testing sufficiently in Arkansas. And so right now, at this point of the month, we're at 108,000 tests. I set as a goal 180,000 tests for PCR tests, and then another 10,000 for the antigen test, 190,000 plus 10,000, so that's 200,000 all total. That is knocking the socks off of our testing plan, and was really testing a lot. And I would ask my staff to look back at the CDC guidelines. The CDC guidelines recommend that a state test 2% of the state's population every month, which would be 60,000. Well, you can see that we're far exceeding the CDC guidelines on testing. And then we submitted our own state plan that set it at 4% that was our goal for testing, and 4% would be at 120,000 that we would do every month, 4% of our population. And we are close to that. We're not there yet, but we're going to easily make that by the end of the month. If you look back where it got us real excited, because last month I think we were 6 to 7% testing of our population each month, and that's where we get up into these numbers. But even though we still would like to be up there because it really gives us more surveillance testing, being in this range exceeds the CDC guidelines and exceeds our testing plan. And so we're testing robustly in Arkansas. We want to test more. But it does give us good eyes as to where our challenges are, and people should understand that. Finally, before I turned over to Dr. Romero, I did want to remark that we have Mike Moore here, our ABC enforcement, and this is an important part of our compliance efforts for our public health guidelines, including the wearing of masks in restaurants and staff wearing masks and social distancing as well. They've conducted 1,210 inspections since they started their COVID inspections, and they have found that 90% of the businesses that they've inspected are compliant, and that means increased utilization of masks, social distancing in the workplace. They have found 113 violations. Most of those are a verbal warning. They rectify that, but they have issued about 17% of those in citations, which shows that we're serious about making sure the public health guidelines are followed. And I want to thank all the ABC enforcement for their efforts, as well as the Department of Health in partnering with them. And with that, I've asked Dr. Romero to go through the counties in terms of the statistics on that and cases. Dr. Romero.
Thank you, Governor. So with regard to the counties, there are 10 counties with 20 cases or more, and in decreasing order: Pulaski at 65, Jefferson at 56, Sebastian at 52, Craighead 4th at 33, Washington County at 32, Pope 30, Benton 29, Mississippi and Garland counties are tied at 25, and Johnson County at 22. A little bit more detail. Hospitalized patients, as mentioned, were at 499. That's an increase of 7. We have 114 patients on a ventilator, increased 8 from yesterday. We've added, unfortunately, 12 souls to the number of deaths to 631, but there is no clustering in any specific area. 3 of those deaths were from nursing homes. Recovered to date, we have 47,666. That's an addition of 696. And active cases are 5,919, comprised by 38 nursing home cases, 961 correctional cases, and 4,920 community cases. Before leaving the podium, I want to remind those individuals that have submitted plans for mitigation in large events to the health department for approval and have them approved, that they should need to follow those guidelines as issued and as corrected by the health department. It is important that those guidelines be adhered to if we want to contain and mitigate spread in large events. So please stick to those guidelines as issued by the health department. Thank you.
Thank you, Governor. Good afternoon. For the last 6 weeks, we have been working alongside with the Governor's office and also the Department of Health. In doing so, we've been given a task of performing inspections, as the Governor said, restaurants and bars and clubs throughout the state. And fortunately, I'm happy to report that the vast majority of those places that we've inspected have been compliant. They've been overwhelmingly motivated to follow the health department's directives and guidelines. That's really good news for several reasons, because the goal of our combined effort is to minimize the risk and mitigate the damage that this virus can obviously cause for not only the patrons but also for the employees at these establishments as well. As of today, as the Governor gave you, our officers have performed 1,210 inspections across the state. Of those 1,210, 90% were found to be compliant with the guidelines and directives concerning COVID-19, with only 10% out of compliance, and of those 10%, only about 17% were issued an administrative citation. The rest were corrected at the time. We really believe that these inspections have been very effective, that we're able to help these businesses understand and the guidelines and the directives that help slow or eliminate the spread of this virus, and you add to that a little bit of accountability, and we see a very positive outcome. We want to encourage everyone to continue to make every effort to follow the rules and be compliant. We know it's not always easy, but it appears to be very effective, and we certainly appreciate everyone's efforts who are trying to make sure that everyone is following these guidelines, and also appreciate the work that our agents are doing out there in the evening hours and on the weekends. Our common goal really is to see your business stay open, and that's good for everybody. That's good for the business owners, that's good for the employees, that's good for the patrons, and also just good for the general economy of our state. That being said, this weekend, as a lot of colleges are becoming active again, college classes starting back up, we're going to take special attention or pay special attention to those areas, and want to encourage those folks to practice the social distancing, the wearing of masks, the washing of their hands very often. And it appears these numbers are going in the right direction as we've watched for the last few days. I've watched the governor give these numbers, and we need to continue to fight this good fight. Even though the numbers are starting to look very well, we can't let up. We have to stay in the fight. We have to make sure that we finish strong, and we do that, I think, by following the direction that we've been given and the good common sense and approach of our governor and also the health department. Thank you.
Thank you, Mike, and thanks for the work of your team as well. With that, we'll take any questions.
Regarding the UAMS projections, specifically what they said about schools and having all online instruction versus all in person or mixed, I was wondering what you thought about their projections showing, there would be more infections with in-person classes.
Well, to me, that's like saying if we sheltered in place, we'd reduce the number of cases that we have, which is true. But we don't shelter in place because there's essential things that have to be done in our society. And the same thing is true with education. Obviously, you reduce risk if you all stayed at home. But we have to do education. The best way to do education is in classroom instruction, but we're providing a virtual option. And so you can't disagree with what was said, but it just ignores the reality and the importance of trying to give the best opportunity for our young people to get the best education under these circumstances. Is there any question remotely?
Hey, Governor, this is Vince.
Hey, Governor, this is Josh White with KAIT.
Yes.
Hey, I had a question. We've had several parents who attended school orientation and here in Region 8 and noticed that the classrooms had 25 students in them, which makes it impossible to be 6 feet apart. How are schools dealing with that? That obviously goes against ADH, so how are we opening schools with that many kids in classrooms?
Well, first, it doesn't go against guidance because that's why you wear a mask, and that's why there'd be a requirement for the students to wear a mask because you cannot socially distance in every classroom. Now, I haven't seen that, and I don't know whether those 25 seats are filled or whether there's a space in between each one of those. So you have to leave that to the local leadership. I've toured many schools, and they're making all of the steps that they can. They're doing different ways in which to have increased number of social distancing during the class day, but that's why students wear a mask. And the requirement is you social distance. If you can't do that, then you wear a mask because that protects others from getting that virus and the spread of it. So the schools are working very hard. Some classrooms are easier to disperse than others are, but that's why we have to wear a mask during the school day. Next.
Governor,
Governor with AP. Wanted to ask you on the unemployment issue, just to make sure I understand. So Arkansas is seeking the $300 amount. Does that mean that you're not Arkansas won't be chipping in the extra amount, the extra $100 for the higher amount under Trump's order? And if that's the case, why not? Was there just lack of legislative support for the larger amount?
The question is a good question. I'm going to comment on it, and I'll give Mike Preston an opportunity to comment on the process and maybe go a little bit more on that particular point. But whenever you look at what would be the source of the state's contribution of $100, it would have to be some of the CARES Act money that has already been allocated out there, and so that would put that money under a strain. And so, and also, I believe that it's very important to get that $300, but we don't want to, I've always said it shouldn't be at the $600 level. And so, whether it's 300 or 400, we want to get that assistance out as quickly as possible, and this is the way to do it. But the guidance is not clear on where that money could come from if there's a state's portion, and the CARES Act money, so much of that is already allocated out. That would be hard to utilize that to meet that state's match on that. Mike, did you have anything else on that?
Thank you, Governor, and Andrew, thank you for the question. So the $300, the $100 would be considered a match. The executive order gave some flexibility to the states, so rather than having to match an additional $100, what we pay out already in our unemployment benefits would count as our state's match. So our 25% would be counted for in what we're already paying out. So that means that Arkansans who are on traditional unemployment or on the pandemic unemployment assistance will be eligible for an additional $300 benefit. So this is what's referred to as the federal pandemic unemployment compensation. As the governor mentioned, that was the original $600 additional benefit. To those individuals receiving it, will just now receive a reduced amount at $300. In order to do the additional $100, as was one of the options through the executive order, as the governor mentioned, it would have cost the state to be able to take on that cost, and our low-end projections were about $250, $265 million in addition to what we're already paying out. So we would not have, or we would have exhausted everything that we had available in the CARES funds had we even been able to utilize that. And there were still some questions back and forth from the guidance on Treasury. It seems that most states have been taking this option to allow us to use the existing payments as our match to cover that.
Thank you, Mike. Next question.
Governor, it's Mitch over at Channel 4 and Fox. Two questions for you, if you don't mind. We've heard about a church revival group that met about 2 weeks ago in Polk County, Scottsville Word of Life Assembly. Is that the origin of a COVID cluster? We've heard about some free screening out there. And then the second question would be, are you getting a COVID-19 test regularly, or how often are you getting that test?
In regards to Polk County, I think if you look back at the growth in cases, they started going up preceding that church service that you're referring to, and I do believe I saw some pictures online of that did cause some concern. Let me emphasize that our churches are doing an incredible job protecting their congregation, social distancing, doing what's needed, mostly online services, but as they go back, they're really doing a good job, and I applaud them for it, paying attention to those guidelines. There's a few exceptions, and obviously that's a concern. So I'm not aware of any particular cluster or number of cases that can be tied to that, but we'll see what time will tell. And Dr. Romero, did you have anything on that? And the second part of your question is, how often do I get a test? I try to follow the Department of Health guidelines. And so I have not been symptomatic. Every day when I come in here, I'm screened for temperature, for symptoms. And so I've only had one test, and that was whenever I went into the White House and visited the president. It was obviously negative, or I wouldn't have got to see him. So that's what I have, and hopefully I don't become in a position that I have to, but if so, we'll cross that bridge. Next question.
Hey, Governor
Governor Asa
Josh Wyden,
Hutchinson, it's
KEIT
Crystal
again.
Martinez.
All right, so
Go ahead, Ms. Martinez.
Okay, thank you. I apologize. It's Crystal Martinez with KNWA News. I have a question for you that actually State Senator Jim Hendren asked. When it comes to testing, we've seen numbers drop and fluctuate in the last few days. Do you believe that's because of limits in capacity or limit in demand? And how do you think that shows the real community infection percentage here in the state?
a great question, and I think I've answered the last part of it in terms of going through what the CDC standard is for testing, which we're exceeding, and we're exceeding actually what our state plan is for testing. So I'm comfortable with the level that we're testing that gives us the information that we need, although we always want to be able to be able to do more, to get even a more intensive look at where we are with the virus. In terms of what is the reason for the decline, and that's an excellent question as to whether that is because the labs are slower in their response, they're backed up, and we're not getting the number of those lab tests, or whether it's a reduction in the demand for those tests by the citizens who need it. And I think it's a combination, and they sort of feed off of each other. If you know, a person thinks, well, I traveled, I think I'll get a test, and they would qualify for that test, but then they think, well, if it takes 4 or 5 days to get that test back, then I don't want to be isolated for those four or 5 days, and so that is a discouragement to get the test done. And so we encourage you to go ahead and get the test done if you feel like you need that, but we want to shorten that time from the commercial labs so it's not a discouragement, and we are shortening that. You're seeing those time frames reduce. Secondly, we did away with the requirement for elective surgeries that might have reduced some of the demand for tests as well. And so what I want to see, and the answer is, I want to see our commercial labs do a better job increasing the supply chain, and so those tests are available, and shorten that time frame. And then secondly, I want everybody to be diligent and don't hesitate to get a test. That's an important part of it. If you have symptoms or if you've traveled, go get a test. And you can go to our public health labs, and they'll make sure that they'll give you a test. Next question.
Governor, this is Josh again at KEIT. I'm using the 25 number just simply because I went to orientation with my son last night, and so that's the number that's easiest in my head. If his teacher tests positive for COVID-19, and there are 25 kids in his class, and they switch to another class during the middle of the day, do all of those kids have to quarantine, and the other teacher, or just the teacher who tested positive?
Well, that's a question, I guess, it's natural for everybody to ask. First of all, they should consult with the Department of Health and get their guidance on that. You know, if you have a teacher that tests positive, then you have to look at the fact, well, what was the social distancing? Was there plexiglass there? Was there masks that were being worn? But, you know, they're going to take an extra level of precaution and probably isolate or quarantine those that came in contact with that teacher. Dr. Romero, do you have a further comment on that?
So thank you, Governor. So the answer is, as specified by the Governor, is not a simple one. It really is dependent on the degree of contact or exposure of the students and other individuals, the staff in the school. That is the job of the contact tracer and the investigators. They will get that information. So it's independent. We can't issue a single recipe for addressing who will be tested. It will depend on how much contact was involved, whether there was use of masks, and whether there was appropriate distancing. So it'll be on an individual class basis that we make that decision.
Thank you.
Thank you. Good question. Next.
Hi, Governor. It's Neil Gladner in Hot Springs. I have two questions, please. The first is the Department of Health's congregate care report last night. If I saw it correctly, and it came out after 5, had 322 new cases.
In congregate care? Yeah. And what's the second part of the question?
So I gathered they didn't get to your report yet because I didn't see a big white part of that line. The second one has to do with college. You've been offering some gentle guidance to college students heading back about social activities, especially. Given for what's happened at Notre Dame and North Carolina, do you feel like you need to take on a stronger role as the state dad and kind of wag your finger a little harder?
You know, as a parent, I don't know if my finger wagging did much good, but you can always try, and we try every day. But more importantly, the administration of our higher education systems, our teachers there, our coaches, all the staff needs to set the right example. They need to make sure there's education going on, not just as what happens on campus, but also in terms of what happens off campus. And so I know they're working hard. Everybody knows what's at risk here. If you watch the news, which I hope during this environment, people do watch the news. Whenever you see what happens at North Carolina, what happens at Notre Dame, that's just a word of caution as to it can happen in Arkansas, and we have to take every precaution. Wouldn't it be a good story if we can say we were successful, if we were able to conduct classes and we didn't have an outbreak? That's such a good example for leadership and student behavior and responsibility. So we'll have to see where it goes. We're doing all we can in terms of messaging, and I know the university's got a good plan in testing, the response capability. There's going to be cases, but it's how we respond to it and the behavior that's associated with it. And I don't have an answer on the, I'm not even sure of the question, on the 322 congregate cases. Do you know anything on that? Was there a question, Neil, on that as to where they came from or what?
No, the congregate care report, Governor, says where they came from the Varna unit, from the Delta unit, from Wrightsville. They're spread over several prisons. I just didn't look like they got into your report of the 700 plus today, so I just didn't know if that lags behind.
Okay, we'll look into that. Good question.
Thank you.
And if it was last night, it would have been in yesterday's report, I would think. But anyway, we'll take a look at that, Neil.
Thank you, sir.
Governor, this is Josh Briggs with the Sling Courier here in Benton, and my question is in regard to testing. From August 6th to the 18th, we've been keeping up with every day that you report the total testing, and we've talked to the Department of Health about backfill testing, and we understand that some tests come in late and are added to the date of results. However, on the 14th, the Department of Health reported that there was a total of 73,150 tests, and then on August 15th, that number jumped to over 85,000, and that means there was 6,500 roughly tests there that were just added in. Are those all attributed to backfill?
Yep. Let me ask Secretary Romero to comment on that.
So I'm sorry, could you give me the specifics again of what what dates?
From August 6th to August 18th, we've been keeping up with a tally of how many tests are reported during the briefing, and then we look at the Department of Health number at the end of the day, because we understand that there are backfill tests.
Yeah. Okay.
Looking specifically at the 14th, there were 73,150 tests reported by the Department of Health. On Saturday, that number jumped to 85,000 tests, despite only 5,700 being reported for the actual day. So that leaves 6,500 tests that were just added in. I was wondering if those are backfill.
Yes. So I mentioned, I believe, earlier this week that we had identified some tests that were not added in. They were in the Rhapsody database. We pulled them out. We've cleaned up the data and have added those back in. So that may be what you're referring to with those numbers.
Final question right here at the table.
On the Little Rock School District Teachers Union, with them saying they're not going to go into the classroom on Monday, has there been any developments with that? And if they do refuse to go in, what would the state's response be?
Well, teachers have a contract, they have a responsibility. I know the school district, whether it's Little Rock or whether it's other place in the state, are working with teachers if they have particular issues, and and with a large percent that's going virtual. I think they have a good plan here, and we expect the teachers to be there. And I know they're nervous. I'm nervous. That's just part of the climate that we're involved in. But what we're doing is important, and I understand the concern of teachers, but we need to have our school year this year, and we're doing everything we can to make sure that that environment is safe. Thank you.